Yes. Welcome. Hello, everyone. Welcome to the second episode of our IPF Community Podcast. Today, I am joined with my lovely friend and a mother and an artist and a hairstylist and a jack of all trades, basically. But my good friend, Kamisha. She'll say hello to the crowd.
Hello, everybody. I am Kamisha. I am a mom. I am a hairstylist. I am a post-healthcare worker because we are not doing that ever again.
You hear that?
We are not going back into the field. And I have a son. He's 2 years old. And I mean, in the gifs, that's all me so far. We'll probably get it more into that because if you can do the math, I'm 2 years old, then you will obviously know that I was pregnant at the beginning of the pandemic. And my pregnancy spanned throughout. So yeah, we'll talk more about that.
Definitely. And that is exactly why we are here. So we are here to talk about our topic of the day today is actually how our mental health was affected. And by us, I mean those other women in the community, especially racialized women in the community who might have been impacted mentally, traumatically, just any aspect of their well-being during the pandemic while they still had to carry someone in their body for 9 months and navigate that and figure out what's best, even though you don't even know what's best for yourself at that moment.
Absolutely.
And kind of just jump in and get into all that conversation and actually focus on and be a space where women can hear someone who actually went through it, as well as we can kind of like come together and realize you're not alone in that. And myself, I am one of the workers on the IPF project for Women's Health in Women's Hands. My name is Shanice, and I am currently 7 months pregnant. So we'll also, near the end, talk about how post-pandemic, if you want to call it that.
Right, because it's definitely still very real.
Yeah.
Definitely still
I see
happening.
the postings on the news saying here and there, the numbers are getting outrageous again. So just thinking about what I'm going to look like going into labor in a few months, and what Kamisha feels like now if she has to have another child in the future, if she wants to, what that trauma will actually translate to. So let's get right in, and I'm going to ask Kamisha the first question to start us off. When you found out you were pregnant, did you also know the pandemic was happening, or was it like, I found out I was pregnant and then the pandemic just came?
So I found out that I was pregnant March of 2020. So I was still working at, where I was working, the long-term care home, for the month of January and February. And it was kind of like brewing. So they didn't really have a lot of conversation about it. It was kind of like, you would hear a little bit of cases here and there, but literally, I found out I was pregnant the first week of March. By the second week, we're in full-blown pandemic. Like, it's That's very crazy. Like, this is closed, that is closed. There's no toilet paper. People are fighting for hand sanitizer. And at that point, I had experienced, I think I got checked and experienced that I was 6 weeks at that point. So I was pregnant for a little bit before I officially was pregnant. And finding out that I was pregnant and having the pandemic happen at the same time, I definitely panicked. I cried. When I say I wept, because I have a lot of allergies. I also have asthma. And so the thought of having to go into my job where my workload is 14-1, I feel sick because I have morning sickness. I had hyperemesis, so I couldn't even keep food down. Couldn't keep down orange juice. Couldn't do anything. The thought of having to go into work and manage a workload, having to wear a mask, having to do all of that gave me like stagnant anxiety. So I ended up having to call my workplace and letting them know, like, listen, I don't feel comfortable going into work. I don't feel like, I can manage, and I'm pregnant. They were like, oh, okay. You're gonna have to prove that.
Wow.
In order for us to like make you stay home, you're gonna have to prove that.
Wow.
So I had to go to a doctor within like the next day, get an ultrasound the next day for an ultrasound to prove.
Yeah.
I didn't just pull this out of nowhere because I heard a pandemic.
Can we just take a moment to talk and make a moment for that? Kamisha, who was working frontline, also pregnant and trying to do what she tried to like force herself or apply herself to still show up for work, went to her healthcare provider to bring like proof of what she was going through as a frontline worker. Like, I think another part of this story that is really amazing is that she tried to like still do her diligence as a frontline worker to not leave her 14 residents that she had to take care of by themselves.
Especially, right? Because they're expecting me to show up. So of course I'm going to call, right? Let them know like, hey, I'm not going to be able to make my next shift. Like, serious life stuff are happening beyond the pandemic, and they're just like, you're gonna have to prove that in order for us to give you some type of leeway. And so I ended up proving it, of course. And I mean, we could talk about how I look at that as a blessing and a curse, but I want to focus on the part of like I was on sick leave because a month later, 2 months later, they called me and they're like, oh, we could find a job for you in the kitchen. I said, I'm not doing that. There's no way I paid for my formal Humber College education. This is not a college a random independent college. This is an accredited school.
Definitely.
Where I graduated with honors. You're not about to put me in nobody's kitchen. No, that's rude. I said, I'm not doing that. I have several allergies, and unless you can ensure I'm not going to touch those things, that's not going to happen. They had no choice but to accommodate. So I was on sick leave until maternity. But every couple months, I would get the threat of like, you have to come back to work. You need to come back to work. We're going to find something for you to do. And I'm going to be honest with you, every single time that I got one of those emails or one of those calls saying, oh, we're going to find a shift for you in July. We're going to find a shift for you in August, would literally put me into a panic attack, like literal crying, literal heaving, unable to catch my breath. And at some point, I got a doctor's note that basically said, you guys cannot ensure her safety. You don't know what this pandemic is looking like. You don't know how it affects somebody who's asthmatic and pregnant. You cannot send her back to work. You have to give her sick leave. And I got that in August. And so I was on sick leave until my maternity. My son was born December 12th, 2020. Throughout that time, I attended all of my appointments by myself. I wasn't allowed to take video, but I've had a few healthcare staff when I did my ultrasounds that allowed for me to FaceTime so that his father can also be able to see. Like most of them were accommodating, but I don't think it was policy. So a lot of them were just like, we don't do this. But I've also expressed to them like, I'm a healthcare worker, and they're like, creed's honor kind of thing. We'll let you do it. And that was helpful. Now, I'm going to speed up to my labor.
Before we get in that, can I ask a quick question?
Yes.
Just for the audience who's listening. Because I think one thing that racialized people suffered throughout the pandemics, from at least what we found in this project, is not knowing how their underlying conditions kind of map with COVID-19 itself.
Oh, for sure.
So when you found out you were pregnant, already knowing your pre-existing conditions such as asthma, was there any panic on the idea of potentially catching COVID?
Oh, yes.
As well as having asthma and seeing how that all would map out while being pregnant, while going through hyperemesis.
Oh, yes. All of those things. Mind you, I never left my house for 4 months. If it wasn't for an appointment, I never left my house. When people would visit, I would have like extra PPE from like when I did nursing, and PPE from when I did PSW, you put that on. You're putting the scrubs on, you're putting the thing on your shoes, the mask, the whole thing. So I didn't get a lot of family visits. My mother-in-law lived in the same building. She was willing to work with the criteria that I gave her. My father-in-law also was willing to work with those parameters. My mother was willing to work with those parameters. Like, other family members were not. They were just like, we're not doing all of that. I'm like, listen, you're going to have to quarantine for at least 4 days before you come to my house. And they're like, yeah, we're not. I'll let you know. None of them people showed up. So...
Which is kind of understandable, but at the same time, it's your experience and you're trying to protect something that is in you. But you, like I said earlier, we don't know how to protect ourselves from COVID without knowing what COVID is ourselves, right?
Exactly.
So we're doing the best we can with the information that was bombarded with us on the news, with healthcare systems like being jam-packed. So even if something was to come up, where would you go in and do diligent time to support you and your future
where you're
child?
Not sitting in a waiting room for 14 hours, further exposing yourself. If you go there and that's not the case, your mind is racing because, okay, if I go here, they tell me, oh, it's just a common cold, but I've been sitting in there for 10 hours. Wow, Samantha's coughing up a lung. John is like, can't taste for nothing and is fighting for air. I'd rather not. And so I was alone at home a lot. I started vlogging, so I did start my vlogging channel because of that. And there's one video that I put up where I was talking about, I'm not a person to cry on the internet, but I cried in that video because the thought of having to go back to work was just like, absolutely not. You know what I mean? That was terrifying. So my labor was 3 days. I labored for 3 days.
Was this at home or at the hospital?
I labored at home for about a day and a half, and then, or more than a day and a half, about 2 days. I'll call it 2 days because I went to the birthing center at like 11 p.m. And I couldn't get past 4 centimeters. And they ended up having to burst my water, and so he had Marconia. So I would have to go to the hospital, which is what I did not want. Because I'm very well aware, as a healthcare worker, I'm very well aware of like the dispositions against people like me, the dispositions against Black women, the dispositions against Indigenous women. Like, I'm very aware of that. And so when I was picking my birthing plan, I picked a midwife over an OB because I didn't want the clinical experience. I wanted something that was a little bit more nurturing. And I picked a birthing center because I wasn't ready to do at home. I've seen the videos. I'm good. You shit in that pool, you kind of gotta pay for that. And I just wasn't completely comfortable with the hospital. So that was like my happy medium. And when that didn't happen, I was forced to go to a hospital. The hospital experience was interesting. It was good for the most part. I had a surgeon that was pretty dismissive. She was trying to get rid of my midwife because I know for a fact when you transfer into a hospital, you don't get to keep your midwife. Your midwife actually has to leave because it's a transfer of care. But at the time, I basically, told the two surgeons, one of them that was on time, I was explaining to him, like, listen, my midwife has to be here. This is my advocate. My fiance cannot advocate for me because his knowledge is not, you know what I mean? It's not there. It's not the same. And I cannot advocate for myself, even though I have the verbal capacity to do so, the vocabulary, the understanding. I get it. However, in this state where I'm in extreme pain and exhaustion.
And labor, if you guys don't know, go check out a YouTube vlog. Also check out Kamisha's, which we will share her
at the end,
YouTube name, but you will see what labor and delivery is like. And you cannot talk or advocate as well as you could any other day.
You can have all the words in the world. That Midol and ginger ale diet will definitely make you forget some things. I was living off of Midol, crackers, and ginger ale for 2 days. So there was no way I was going to be able to speak for myself in terms of what I want.
And if I can quickly ask, was your partner allowed to be in the room as well? Let's say you didn't have your midwife, but was there any restrictions on how many people were allowed in the room with you because of COVID still, or was there
were
a leniency?
There were. I could only have one other person though at that time. So in the beginning, when I had like sent in my forms to secure my hospital, it was like, no, you and the midwife. And then as I progressed, they ended up saying, okay, well, you and your partner and your midwife. Your mother-in-law cannot come. Your mom cannot come.
I was just curious because I always see midwife as being not necessarily, I mean, they are a physical extra human in the room, but I don't see them as being an extra person, which would interfere with the situation.
Their medical staff.
So they're kind of just someone in the corner. Like, they can stand in the corner and say, okay, breathe out, or you're doing great, or how about you try this, or coach your partner along the way, where I never understood during the pandemic why that was, because you're not the first person I heard as well that said they kind of had to, like, swap out really quickly, or near the end, like, the mother would just be having a full-blown panic attack, anxiety attack, where staff was like, fine, just like, let it be.
So, and I feel like it's kind of like that, except my panic attack was very eloquent in terms of like, this is my advocate. I'm not calling her a support system. I'm not calling her a favorite cousin or auntie. This is my advocate. And I have a right to an advocate. Definitely. It cannot be him. He has to be here because he is the father and he's allowed to. She is my advocate right now. If anything happens to me medically, legally, this is the person that I'm giving that power of attorney to. She cannot leave the room. And they were like, okay. You know what you're doing. You know what you're doing. So shout out to Dion. She's amazing. Toronto midwives of Toronto. She was amazing. When I had the second surgeon come in, Miss Ma'am did not even introduce herself.
Wow.
She came in and shoved her whole forearm up my vagina without saying who she is, why she's here. And I knew that was wrong because when you're in healthcare, they teach you
consent.
Okay. When you come in, you must introduce yourself. Why are you here? What is your name? What is your date of birth? I got none of that. I made sure when I was done, I wrote a letter with her name included. I wrote 3. They sent 3 of those. I sent all 3 of them back with her name and an indication of what I experienced, because it was very insensitive. Even though the what she wanted to do, which was make me labor for the rest of the day. So eventually I got an epidural because it was like, listen, this is not gonna happen. I'm tired. This is not gonna work. I got an epidural. She wanted me to labor the entire day. And I'm like, if his heart rate is going up and then going down, and every time it comes back up, it goes lower when it goes down. I don't want to wait until the end of the day to see what happens, see if I get to 10 centimeters. She was very dismissive of that. I looked at her and I said, listen, the first doctor was on time. We came up with the plan. I signed the waiver for the C-section. We're not doing what you're saying we're doing. You know what I mean? And she's like, well, I just want to see. You're not going to see with my baby and me. You know what I mean? That type of dismissiveness towards my pain, towards my exhaustion, towards like getting me what I need. And so that wasn't the best experience for me. But my C-section was beautiful.
Did you have to wear a mask at all during your C-section?
They tried.
Okay.
That was not happening.
And did your partner have to wear
a mask? He did. He had to wear a mask. He was able to come into the room, the C-section room, which is also something that, again, I feel like if I wasn't so eloquent in how I spoke, a lot of these things would not have happened, because we are still full-blown pandemic December 12th, 2020. So a lot of it, I feel like, because I was very eloquent in how I spoke and very clear in using the right words and speaking and talking about what I wanted, and so that was able to happen. Post-pandemic now, post-baby, I should say, I had some issues with my C-section, and they were giving me a nurse to come to my home every day to clean I had to go back a week after and get my incision reopened and drained because it wasn't closed properly by the surgeon that I had.
Yeah.
Which added to my third letter.
Yeah.
Ma'am did not close.
And if I can just say a disclaimer real quick to the folks that are listening. In no way or form is this podcast belittling any nursing staff
for sure.
doctors or whatever
Absolutely
healthcare
not.
providers at all. We are simply just shining light to a racialized woman, Kamisha, who also happens to be a frontline worker prior to her delivery. Her experience and what she went through and what she felt in that moment. But by no means are we saying, trash everyone else that was part of this.
No.
It's just her experience. And there are many other women who feel like there could have been a different approach to the service that was given, whether there was a pandemic or not. So just want to throw that out there before we get into the furthermore of it. So recovery stage.
My recovery nurse out of my surgery was amazing. She was an amazing woman. My daytime nurse when I stayed for recovery was amazing. My nighttime nurse was not the best, but you know what I mean? It's nighttime. I'm not expecting her to be perfect.
You gotta take
the lady next to me was screaming. She was doing what she could. But when I got home, my incision had to get reopened, drained. I had to, have a nurse come in every day, take care of it. At some point, after a week of my 6 weeks, I would have to leave my son to go to a clinic because of COVID, they couldn't continue to keep sending someone into my home. Yeah. They had to reserve that for people who could not leave their home. And because technically I could leave my home, even though I shouldn't be on my feet and can't bear weight, they're like, okay, you're going to have to go to a center, which was fine. I did the center for a few weeks. And then after a few weeks, I had to prove that I could do my own care. So for 3 weeks of my 6 weeks, I had to do my own wound care.
Would you have to go back and show them what you did, like your work, so they could process it?
But I would have to do it at the end of the week.
Oh, okay.
So I would have to go back once a week instead of going every day, because I was going every day for 2 weeks. Yeah. And then they're like, okay, we're going to trust you. Like, we're going to watch you do your wound care, do your irrigation, put your stuffing, take it up. Like, we're going to watch you do that. Yeah. I did it. They passed me. I said, well, yes. I'm really great at what I do. It was an interesting time for me after that.
And if you think about it, you gave birth December 12th. So if you're counting the weeks, that was like the January. Rest of December.
Yep.
Going into the holidays, just trying to find time to like kind of recuperate with you're delivering a child and bringing life into this world. And then
breastfeeding, the whole thing.
Extra madness to add within dealing with someone coming into the house again, not knowing, not necessarily that they're not being safe while they're at other places, but you never know what you can bring into someone's
They're going
house
into multiple houses on their shift, right?
So like, I feel like, if I can say, and you can correct me if I'm wrong, but there was a lot of like just mental stress.
Oh my goodness.
All within those 6 weeks after December 12th.
Listen, having to have the woman who came and did my care, she was amazing too. And she was down with the whole, take the whole thing off. Yeah. The jacket, the shoes, the whole shebang.
Not the quick, I'll keep my jacket on because I'm leaving soon.
Oh no, Miss Ma'am was outside in the hallway in her socks. Her socks and her jacket hung on a bag outside of my house. Okay. And then she would come in and get dressed in the gown, the mask, the whole, do the care, get undressed. I would stand there with gloves and a plastic bag for her to take off all her stuff, put it in the garbage, and then go outside.
Can we give a clap for that? That was coming because she really went above and beyond when she didn't. She does have to, but sometimes you just gotta. Some of them just want to, quickly get in and get out, but she went above and beyond and didn't question that. So
and she pushed for me to contact Lynn and request for more for them to come in for an additional week. Like she pushed for it because she's like, yes, you don't have COVID, but you just had a baby. Yeah, you need them to come in. Definitely, you need me to come in. You need someone to come in. So she was amazing. But that was my labor. That was my labor time. Yeah.
And now fast forward after that 6 weeks, we're kind of coming into out of the pandemic, but still like, oh, do we still want people around us or not?
No.
So what was that like now that you kind of recovered a little bit with your C-section? You have your baby who is probably going on a month now because of the 6 weeks, give or take, and kind of coming into where the pandemic seems to be like peaking out, says the news outlets. We're not really sure.
There were talks, but nothing was ever significant because the numbers were raising.
Yeah. But I know we talked earlier before we started this podcast that obviously when you have a baby, you have your 1 week appointment. I think you have your 2 week appointment, and then you have your month-old appointment, if I'm not mistaken. I had my son 5 years ago, so mind with me. But yes. In that time, that's when kind of like the vaccination was like drilled into the community that you have to get it, or you cannot receive healthcare in any capacity. Or they have to visually see you through a laptop screen or on your phone, which doesn't really do anything if you're physically going through something like eternally in your body. But needless to say, you had a newborn and now the vaccination is coming up. And now you have to start that process. What was that like?
So we were okay for the first 4 months of his life. A lot of our appointments were, were honored regardless of the case. It was when he got to about 8 months and he started to experience, their nasal passages are smaller, little things are changing, but you're still, he can sneeze and you're thinking, okay, now he has a cold. Right. Now he has a cold. He's cold. Who's the last one here? Like that kind of stuff. There were a couple of times where we would go try to take him to like a walk-in pediatrician's clinic because we couldn't get an appointment with his doctor. Also, his pediatrician would not see us because we weren't vaccinated.
You and your partner.
Me and my partner weren't vaccinated. And both of us kind of had to be there.
Definitely.
His pediatrician's office wouldn't see us. They said we'll do virtual visits. And I just that wasn't enough for me. I wanted someone to see my baby.
Definitely.
This is a whole new person. I just met them.
We're still strangers at this point.
We're still strangers. Yeah. You know what I mean? So there were a few pediatrician's office that when we would call, they would ask us if we were vaccinated and we weren't. And they were like, so you can't bring your son. I'm like, but he's the one who's sick. And they're like, well, he can't get a vaccination. Well, obviously, he's under 1. It's like, okay, well, you guys need to be vaccinated. And it's like, well, so how is, like, so no one's going to see our son. They're like, oh, well, that's our policy. Then we call the next one. Well, that's our policy. Then we call the next one. Well, that's our policy. And so we had to work with the virtual appointments. And then eventually it kind of put us in a position where it's like, we've lived our lives. What's the worst that can happen? Because there was so much unclear about vaccinations. Definitely. And there was so much propaganda around adverse events, adverse effects, side effects, all these different things. And so we didn't really want to get it, but if our son really does get sick, then what are we gonna do? We can't. Taking him to the hospital was an absolute not gonna happen because I was like terrified. The hospital is a huge ass cesspool of bacteria to me. This is not to like, you know what I mean? Like I know communal bacteria spreads faster when somebody goes into a hospital. And that's just my educational experience. So I was just like, that's not going to happen. So eventually we ended up and caved in and got the vaccination. We had gotten Pfizer because we felt like it had the least amount of propaganda around it in terms of adverse effects. And so that was one of the things that we thought about, and what made us do it was the simple fact that we need someone to see our baby. Whether I'm realistic in like him being sick or not, I needed my mind to be at ease. And if I have to take something that even if I'm afraid it's going to harm me, I'm going to take it because I don't necessarily... He just got here. I've been here a whole 28 years. If something's supposed to happen, it would have happened already. He still has not even a whole 365. So...
That makes sense.
So that was the choice that we were forced with at the time because the constant pediatrician clinics refusals was just too much.
Yeah.
And I mean, I was at home, I was on maternity, but my mental health definitely suffered a lot. And I don't know if I've told you, but in November of 2021, I ended up getting 12 therapy sessions from Women's Health and Women's Hands.
Amazing.
Yeah, which was life-changing. Yeah. When I say like that was a life-changing experience for me, it was a huge push to get me out of the postpartum depression, because I had postpartum depression. It was diagnosed by my doctor. And a lot of it came from the anxiety and fear of my maternity ending, and I have to go back to work. Yes. And we're still in the pandemic. And now I have this little person whose immune system is developing, and I don't want them to get COVID from me going to work and coming home. And this was before my maternity was even over. Yeah. And it was in my third session that I was speaking to my therapist, and I told her, like, I don't want to do this. I don't want to go. Like, she told me, you know, close your eyes and just put yourself in a space where you would have to go back to work. And I had a panic attack. Yeah. I had a panic attack. I cried. I couldn't catch my breath for at least 12 minutes of just constant heaving panic. And she told me, like, so, you know, going back is a no. I don't know what you're going to do. Yeah. You know what I mean? Like, what is something that you enjoy doing? Because going back into that is not it. It's not going to work.
Do you think you were more hesitant to go back because you kind of experienced so much already in the pandemic, where it was like just hard to be placed back in there after having that maternity leave? Or do you think it was, I know how to care for myself in the pandemic, but I don't know how other people are caring for themselves in the pandemic, to then make me feel safe enough to be in that space with them? Or do you think it was a combination of both, or something completely different, where the pandemic, COVID, all of that, throw it in a bag, I want no part, leave me?
I want to say that it is a combination of both. Okay. I feel like it's a combination of both, simply because I was stepping back into a well-known hospital. I was stepping back into a space where I was also being updated on how things were going there, even though I wasn't there. Yeah. And I feel like I was being updated formally through emails, and I was being updated through staff that I know are actually working there. So you get one email that says one thing, and then you have your friend on shift saying, baby girl, that's not what's happening. Yeah. These people are doing something else. Things are changing, you know, the responsibility is more, we have more parameters around what we're supposed to be doing. Your shift's not normal anymore. It's not come in and do this, it's come in and do all of these things before you even get on the floor. Like, I just felt like the responsibility got so much heavier. On top of considering the fact that I'm gonna spend 8 hours of my day, sometimes 10, with these people. Their families, because at that time they were letting families visit. So there were too many factors. Definitely. Because now it's not just the client and the patient. I'm dealing with the patient, they children, they grandchildren, like everybody coming.
And then 10 hours on the shift, but when you go home, you have to shower, you have to decontaminate yourself. You have to make sure like the space around you is clean. And I don't know for you, but for myself, when I would come home from work, I was literally like Lysoling, Cloroxing, cleaning like everything, even though I knew I cleaned already and I was clean, but I still was like, you know, before dinner even starts, I have to do this again. And by that time, it was 7. And before you know it, it was bedtime and up again for 7 o'clock in the morning. So
to show up for my 7 to 3. So I'm getting up
to then 5. Be overwhelmed again with the next day.
And at that time, I'm thinking about childcare. I'm thinking about, you know, his dad staying home because he works from home. He's still working. It's not like he's at home doing nothing. He's at home working. And it's his first child with a newborn. He's never had a baby in a house with him before. I've had nieces and nephews. I could function. He cannot. And so just having to manage all of those things, it just, the thought of it weighed on me so much. It was an absolute not going to happen. And so through therapy, talking through a lot of other personal stuff, it was like the next succession of my life had to be a space or a situation where I can organize my hours, where I can control the kind of people I experience. Yeah. I can control, if I'm a hairstylist, so if somebody wants to book an appointment, I can put them through screening. Yeah. I can decide whether or not to take that client or not. I can decide if I want to do this in my home or go to theirs. Like, I have the option and I have the control. Yeah. And I just feel like if stepping into that, I wouldn't have that. Definitely. But the income and the stability of having a regular check come in would make me complacent in terms of, if they told me you need to get a booster shot, I'm going to do it. If they told me that I have to, take this vaccine over another, I'm going to do it because this is my source of income. Yeah. I did not want to get stuck into that state. Yeah. I did not want to get comfortable with mediocrity. I didn't want to get stuck in the space of, okay, I know this check is coming, so I'm going to just do this. Yeah. I didn't think it would have made me a better healthcare worker either. Mm-hmm. And I don't think it would have made me a better mom. And I just did not want to, I felt like this is the harder way, but the chances of growth were exponential as opposed to like, oh, we're just going to stay here. Yeah. Do you know what I mean?
You're gambling on something, but the question that I always ask and always try to be mindful of myself as well, even now, is it worth gambling what potentially could happen over my mental health? And my mental health cannot take another impact. With what happened in COVID. And that's another episode for another time, but dealing with something and being able to like validate and vocalize what you're going through. Like Kamisha said, she went and got the therapy. She realized that something's not right, and it's not even as she mentioned, and correct me again if I'm wrong, but not postpartum because she has a new baby and she doesn't love the baby, but postpartum as in so much has happened back to back where I didn't have time to even like
breathe and take in my reality as it is happening. Right?
So there's different forms of postpartum as well, where it's not just I can't look at my baby and they're making me sad, but postpartum as in your life just shifted, and understanding how you got from A to B so quickly and like a blink of an eye is also a way that postpartum depression can
and you don't want to make the wrong decision that's going to affect this new person that like you don't want the consequences of your choices to ruin this person.
It's no longer you picking Big Macs or a Caesar salad.
Do we make it a large fries or a medium?
We're actually it's like deciding real health, real life choices, where we live, what school they're going to go to, religion aspects, like even picking their name sometimes is like a whole other stress because you're like, what will their life look like if I name them this over this? Like, there's just a lot of things that go into it. But if we can shift gears a little bit, because you mentioned, getting vaccinated after having your son and feeling a little bit pressured, like the only way I can make a good health path for the future is if I do this. Looking back now and with what the media was putting out or what the news was saying or blogs or wherever you were getting your information from, did you have any concerns about future pregnancies getting, and was Pfizer enough of a conversation where that thought didn't come into play because of the residual effects that it might have, or do you still feel we don't know until that time happens?
I don't think that I felt like it would affect future pregnancies, and I would want to say that my educational background with nursing and with healthcare was a huge reason for that, because I feel like the general public does not have the knowledge and like they'll say common sense isn't common kind of thing, but I feel like when you've had training like we've had, or I did George Brown for 2.5 years as an RPN, like I have an understanding of how medications work. I have an understanding of how vaccines, live or dead, work. Like, I'm very aware of how those things work. I understand how the body works. I understand how long those things sit in the body and how they affect. So to me, in my mind, I'm like, the next time I have a child, my body will have regenerated at least several cells before, you know what I mean?
Yeah.
I just didn't feel like I didn't think that far ahead. And I also didn't feel like it would have a significant effect.
Yeah.
Now, the only thing that would prevent me from wanting to have another child is the overall social, political, and economic effect of a pandemic.
Okay.
The mental.
Yeah.
I don't want to get pregnant again and have them say the world shut down.
Yeah.
I don't think I can do that again. Have everything change so drastically like that is not something I want to experience pregnant. The next time that I have a baby, I want to be around my family. I want them to be able to come around me. I want to be able to go outside and talk to my neighbor. I want to be able to like live my life and have, I don't want to say normal, but have the expected experience that a pregnant person has. Like, I want my fiance to come to my appointments. I want my mother and my mother-in-law to be in the room. I want that.
Yeah.
And I feel like if I get pregnant and a pandemic, I'm not going to get that.
Yeah.
That's not what's going to happen. I don't think it had much to do with the vaccine because my mental just doesn't process it as that.
Yeah.
Now, it's not to say that people who've had residual effects, that's not, their experience isn't real.
Yeah.
Because if you and I know, health doesn't show up the same in everybody.
Yeah.
Disease and pathogen, they don't show up the same in everybody.
Yeah.
So I cannot expect what happened to Susie to happen to Sam. It's not the same thing, right?
Definitely.
But it's also not common knowledge.
Yeah.
So I can't discredit, how people feel about that.
That makes sense, because
right?
me being pregnant now, I mean, it was not a wait if I wanted more children, but like I was already coming down from my mental health impact, where I was like, okay, I'm finally getting my bearings again. Is pregnancy something I wanted to add again? Well, God had other plans, and He already said, girl, we already did that.
Listen, you are here.
When that happened, I think something shifted again in me, because I just came out of being a healthcare worker, like frontline worker, having COVID myself and all those mental health difficulties, and coming out of therapy, where I knew being pregnant is also in like the first trimester is already an isolating factor. You don't know who you want to share with. You don't know who you should share with. You don't know if it's real. You don't know anything what's happening inside of you other than the stick of your pregnancy test
is plus.
Yes. So it was very isolating for me, where I felt like I was in COVID again without having COVID itself. I just felt like socially defeated. I was isolated, and my partner, he was very supportive, but also he didn't understand what that felt like for me, because I couldn't vocalize what I was going through. I just knew shutting down was something I had to do, because I was trying to make sure the baby was still thriving. But with that, being pregnant now, and even though it seems that there's a quote unquote normalcy to our lives, I go into doctor's appointments and I get like hot, like my body gets hot, because masks are not mandatory in every offices. Someone can come in there and have some type of documentation saying why they don't need to wear a mask. But I have a mask on, and masks already for me, although I wore it prior to the pandemic as a frontline worker, I still had the choice. Like, I knew how long I was going to be with that resident, where it didn't impact me to like get overwhelmed or claustrophobic with having a mask. But sitting in a doctor's office, even now, after the pandemic, because the wait times are like bombarded with clients and patients.
Unreal.
That I could be sitting with a mask on for like 2 hours, and that gets me like
hot.
Like, it's just a crazy feeling. And now, I've heard women say that they've tested positive actually as they're getting labor, where then their whole labor plan shifts.
Mm-hmm.
And I don't want to think negative, but one thing that also Kamisha shared earlier is you have to have a delivery plan, a labor plan, that your midwife, your OB, your doula, whatever the case may be, walks through with you prior to the weeks coming up where you actually give birth. And that can change like that. So not knowing the possibilities, but also knowing what could happen brings a lot of anxiety to me while being pregnant now, where I kind of don't leave my house or I attempt to leave my house, but then I'm like, I don't think so. Or I look outside, I'm like, there's like too many people. Or I'll go out somewhere and see that there's too many people and like turn back and come home. Like, it's just a lot, where most of my shopping that I've done for my baby has been online, where when I was pregnant 5 years ago with my son, I was in the stores. I wanted to like do my registry and click and do all that stuff, all the fun stuff that I experienced with my son. I felt like I missed out this time around with just having those back thoughts. So to throw it back to Kamisha, do you think everything that you've been through, all of the mental health obstacles that you had to overcome, will that still be in the back of your head come the future, even if there isn't a pandemic, just because of those experiences? Or do you think, that was that, this will be this?
In short form, yes. Yes, definitely. I still experience like post anxiety when it comes to crowds, overwhelming spaces, overwhelming amounts of people.
Yeah.
That tickle in your throat cough, the rubbing of the hands on your nose.
Yeah.
Some people have like nervous tics where they do that,
or the people standing, you're punching in your ATM, your debit card, and they're like right there breathing on the back of your neck.
Ooh.
And you have to be respectful because they might be an older person, but you just turn back and give that look like,
ooh,
girl, we still have COVID.
Disclaimer, I do not promote violence, but I'm going to tell you one thing. I went to Staples and I was checking out, and this lady was literally so close to me. I turned to her, I said, ma'am, unless you're going to pay for this, I will throat check you if you step any closer to me. Because why are you so close? Yeah. Miss Man, you want to put your card in? Do you want to put your card in? She stepped back. I said, yeah, that's a good idea, ma'am.
There's still a 2 feet requirement. That's unspoken of.
I'm sorry, COVID, step back, man. There's no need. So yeah, like I have that, I still have residual anxiety about being in spaces where there's too many people and there's no chance of like creating distance. That's still like a thing for me. I was invited to a concert, did not happen. I was not going to that. So I'm like, listen, how many exits are there? Oh God, there's only 2? Because that's too many people. You know what I mean? Like, to me, that's too many. I went to Fantasy Fair one Saturday to bring my son, and there were so many people with children. I love them. Gross. And in my mind, I'm like, I don't want to bring my son here because there's too many coughing, sneezing, grandma coughing, auntie coughing, baby coughing, everybody sneezing, all of those things. So I definitely still have some post-pandemic.
It's like trying to find a balance, like go back to allowing your child to be a child, but also in a space that's safe for them, but also safe for yourself. And although vaccinations are available for children of certain age groups now, the same thought process of or hesitancy that we might have had getting our vaccines, that is now duplicated because you have a child where you're like, wow, I mean, they get the regular shots, but like this
is different.
We don't know yet.
And you usually don't know until like 10 years later.
Yeah.
So you don't want to be the one to make a decision like that. So yeah.
But yeah, this was a wonderful conversation.
It was.
It really shined light on some of the things, the challenges, not even things, challenges that women face, racialized women face, mothers face, that wasn't really spoken about. You hear a lot during the pandemic of how frontline workers were impacted, but besides that, there's a whole nother community, such as mothers that were birthing during the pandemic, that did not have the space to share that. So this conversation hopefully will tie it in together and sit well with you or resonate with you or somebody you know.
Hopefully, because we belong to both.
We got it all over here. But before we end this this episode, I would like Kamisha to share some of her, if she feels comfortable, her social medias, where to find her, her YouTube channel, and what kind of content she puts out. And if she wants to do a shameless plug, she can also put where she does hair if you ever want an appointment. So share those quickly before we end off.
My Instagram and YouTube is I am Misha OD. That is IAMMISHAOD. Both the Instagram and the YouTube are the same. My business page or my hair page is New Being Hair, which is NU_BEING hair. And the salon I currently work at is in Pickering. It's called This Is Curl Code. It is by Liverpool, by the Peer, in Pickering area. So if you're in Durham, you can come and check me out at This Is Curl Code. Those are all my socials.
How do you feel about this episode?
I feel good.
Yeah,
I feel good. I'm always open to like sharing my experience. I mean, I share it with people all the time because I am a huge believer in informed consent. Yes. So I always like to tell people my personal experience with stuff so that they can, like, the honest and raw. I mean, we kind of kept it very, for this, but like I always share my experience with things very raw and in detail for people so that they can have like all the possibilities and make the best choices.
Definitely.
So.
And as Kamisha mentioned earlier, she went through Women's Health and Women's Hands to get her therapy.
Please.
And that is a place downtown to Carlton Street that offers many services for racialized women, no documentation women, immigrant women,
all of them,
young, middle-aged, older, mothers, people of the LGBTQ plus community, every aspect that you can think of. Women's Health and Women's Hands will not turn you away. And if they don't have the resources themselves, they will work hard to direct you to where they partner with or other agencies that offer those support systems. Like I said, this is the IPF Community Podcast. So our project is working on and putting out information to make sure that women in the racialized communities understand that there is a part at Women's Health and Women's Hands that understand what happened, where they came from, all of their struggles or mental health overlays that they had to go through during the pandemic, and be that space for them to come together.
Absolutely.
So I hope you enjoyed this podcast episode. Look out for the other episode. There should be a few more. I won't share those topics, as keep it a little surprise with it, right? But thank you again for tuning in. Yay. And thank you, Kamisha, for joining me.
You're welcome.